Number 2, inflammation. So after a concussion, there's going to be inflammation. After any injury, there's going to be inflammation. Inflammation, particularly in the brain, can cause headaches. This can be exacerbated or prolonged, and the way that I feel on this is because what happens if there's inflammation that happens inside the brain or any tissue whatsoever, that inflammation tends to cause more inflammation to come to the area. So if you have damage to some healthy tissue, you get these inflammatory markers in the brain cell. They're called microglia, and they become activated. When the microglia become activated, they release these other little markers that attract more inflammation to the area. And that inflammation can start to actually damage some of the healthy tissue. And then that sends out its inflammatory mediators, and then more inflammation can come to the area. And so you get this kind of cyclical inflammatory response that can continue months after the injury has taken place. So there's a few ways that we can squash this. One is potentially anti-inflammatory medications, right? These are your NSAIDs, your non-steroidal anti-inflammatories, or maybe even something more potent to squash inflammation and shut that down. The other way, which I tend to gravitate towards more frequently, is diet. The diet that we're currently eating, let's call it the North American diet, is shit. It's filled with preservatives and all sorts of things that promote inflammation. The big inflammatory things you've often probably heard from other things are gluten, dairy, sugar, alcohol, and in some cases eggs. There's other things that may be more subtle, but sometimes people's bodies react to these foods. You don't even know that you have an issue with it until the injury occurs. There's this system that's called the gut-brain axis. The gut itself has some permeability to it, meaning it allows things through the gut lining, right? Your intestinal system, when you eat food, it's breaking it down as it moves through the digestive tract, and you're getting molecules that are coming through which you're using as nutrients for your body. Inflammatory foods tend to break down that gut lining and increase the permeability. So now, rather than getting little pieces of nutrients through, you're getting big molecules of, let's say, gluten or dairy or whatever else through, and your body says, what is that? It sees it as a foreign entity, so it attacks it. Well, this creates an inflammatory response. Your immune system is attacking something. That's inflammation. That inflammation can then go up to the brain and make you feel foggy, fatigued, lethargic, give you headaches, etc. So certain people that have food sensitivities will notice that after they eat certain things, they get a headache. Or if you ever have a big, pasta, carbohydrate-filled meal, you feel lethargic and you need to have a nap and all that stuff. That is that response. After concussion, what has been found, and this is only mostly in animal studies so far, so we still have a long way to go on this, but after a concussion injury, the permeability of the gut lining increases. So even things that may not have bothered you prior to concussion are now creating this constant immune inflammatory response. Because of that inflammation is going up to the brain. Then the brain, with inflammation in it, is causing increased permeability of the gut, which is then causing increased inflammation in the brain. And it just goes in cycles like that. So in order to kind of squash this, one of the ideas or one of the targets behind concussion rehab and treatment is to look at diet and trying to repair the gut lining, right? Things like probiotics and eating an anti-inflammatory diet. Now, anti-inflammatory diet is kind of a misnomer. Generally, what I try to say is just avoid the foods that are pro-inflammatory. And everyone is kind of different on this. So I would suggest doing this and coordinating it through a naturopathic doctor, chiropractor, through a functional medicine doctor, somebody like that that has a really good understanding, dietitian even in some cases, has a really good understanding of this process and how to, help you, kind of guide you through this, because a lot of this stuff is trial and error, and you have to try and figure out what it is. The big ones that I'll recommend right off the bat to anyone with a concussion is to avoid gluten, avoid dairy, avoid any refined sugars, right? You can eat fruits and things like that, but avoid any refined sugars or added sugars. Alcohol and eggs, those tend to be the most the things that most people have issues with. And so if we can avoid that, squash that down. And I've had patients before, years and years after having concussion headaches that are constant all the time, we switch up their diet, and within a few weeks they're going, oh my God, my energy levels, my sleep, my headaches are down. And all it took was kind of going into this low inflammatory, or kind of more of an elimination type diet, just eating clean for a period of time to try and see how it affects you. But again, always do this in conjunction with a healthcare professional that can help to guide you through it.